Hey guys, Dr. Chad Bosha, owner of Repair Sports Institute. Wanted to discuss a little bit about low back pain and sciatica today. So we had our first workshop this past Tuesday, had a great turnout, and we discussed the common causes of low back pain and what people commonly refer to as sciatica. So the biggest misnomer is everything that goes down the leg is not sciatica. So the sciatic nerve is a combination of multiple nerves that come out of the back and run through the hip. And if it's compressed in the low back due to a pathology, or it's compressed in the hip or into the peripheral leg, then it could potentially be sciatica. But what also can happen is SI dysfunction, so talking about the sacrum and the ilium, or your hips in the back part, which often also refer from those little knobs in your low back and kind of out to the lateral side of your hip. That can commonly be misdiagnosed as sciatica as well. Also in the low back, we have HNP, or a herniated disc, which can compress a nerve, and then that also sends radicular symptoms down into the leg. And the last most common diagnosis for low back pain is what's called stenosis. So outside of the spine, we have little holes that all the nerves run out of, and that space is a space that can get compressed, and that is stenosis. So with all of these diagnoses, we here at Repair are going to diagnose the patient, educate on what the diagnosis is, and then how we are going to manage those symptoms and impairments. Most often, we will address the soft tissue in the low back, in the hips, and the hip flexors, as well as those attached to the low back. And then we'll also work on the joint itself. So when there is a pathology in a joint, it often gets restricted, and therefore we want to do manual therapy in order to open up those joints locally in the back, but then also in the hips and above the lumbar spine, which would be the thoracic spine, and then below, which could be the knees, the hips, the ankles, all of those. And then lastly, what really kind of differentiates us from a lot of other therapy places is we're going to very focus on activating the transverse abdominis, the other muscles that stabilize our spine, and then we're going to move a little bit more globally and start working on the big movers. So the glutes, the hamstrings, the quads, and how they work together in order to move a little bit more functionally, therefore decreasing some of the wear and tear on the lumbar spine. So thank you for checking in. This is Chad Bosha. If you have any more specific questions, please email me at chad@repairsi.com or check us out at repairsi.com. Have a good night.